During the COVID-19 pandemic in Nigeria, the country's response to the pandemic was undermined by its poor healthcare system, which many related to severe low government spending on health, poor transparency, and accountability. On December 12, 2023, during the commemoration of the Universal Health Coverage Day, President Bola Ahmed Tinubu pledged the allocation of increased funds to the sector in the proposed 2024 budget, with commitment to providing accessible and quality healthcare services.
Nigeria's commitment to achieving universal healthcare coverage is reflected in the unwavering dedication of my administration to uphold this right for every individual, young or old, in rural or urban areas. That is why in our 2024 budget proposal, we have increased allocation to health and social welfare as key elements for our nation's human capital development. They give us the mandate. All we pledged that we will serve them. Now we must deliver.
Meanwhile, throughout 2023, the health sector witnessed a flurry of public health emergencies, including Lassa fever, cholera, monkeypox, meningitis, and a humanitarian crisis in the Northeast. Diphtheria in particular surged with 13,145 cases and 493 deaths reported by October 5, 2023. The outbreak had been reported in 8 federal states, with Kano State bearing the brunt of it due to suboptimal vaccination coverage.
In this vaccination phase, we have recorded 6,505 mild adverse events. No serious adverse events directly linked to the vaccination has been recorded. We will continue to work with the states and LGS to document all of these adverse events. It is important to note that for complete protection, the 3 doses of these vaccines are required. The federal government remains fully committed to supplying the necessary vaccines to reach the target population and effectively reduce the burden of diphtheria in these areas.
Reports indicated that out of 34,076 primary healthcare centers across Nigeria, only 20% are functional. 6 years into the scheme to revitalize over 10,000 primary healthcare centers initiated by the past president Muhammadu Buhari, less than 25% of these facilities are currently operational. The coordinating Minister of Health and Social Welfare, upon assumption to office in September 2023, unveiled his 4 pillars in line with Tinubu's agenda, which includes health governance, population health outcomes, medical industrialization, and health security in terms of preparedness for outbreaks.
The President has made his commitment. Nigerians have given him a mandate, but it is all of us now, and we are prepared to lead in that direction. We'll do that in 4 main areas. First, to improve the quality of governance in health, how we lead the ministry, how our agencies are led, how the hospitals themselves are led, the leadership of the hospitals. The second bucket is to improve population health outcomes. The third bucket is this whole area of medical value chain, medical industrialization.
The Minister of Health also outlined plans to double the number of fully functional primary healthcare centers from 8,809 to 17,618 by 2027 across all states and the Federal Capital Territory.
Starting by making the 8,809 facilities fully functional and gradually increasing to 17,000 by 2027 in all the 36 and the FCT, as was directed and signed with you, Mr. President.
In August 2023, The Nigerian healthcare sector is said to have experienced an increased rating of 54% from the 39% recorded in 2017. The Joint External Evaluation Score (JEE) not only demonstrates the country's progress, but also suggests that the likelihood of the next pandemic originating from Nigeria is low.
It is a pleasure to announce that at the end of the 2023 JEE, the ready score is now 54%. We have seen what appears to be a 10% increase in the domain for prevent, an 8% increase in the domain for detect, and 50 and an increase of 18% in the domain for response, and an even greater increase under other IHR hazards.
The federal government has launched its Strategy and Implementation Plan 2023 to 2027 in the mission to tackle emerging public health threats and evolving challenges.
Our new strategy is focused on systems, on scaling and sustainability, leveraging the strategic, ambitious speed and scale, what we call the SAS approach, to accelerating the impact of health security interventions in Nigeria, and of course, helping us serve as a model to other African countries.
The health sector also witnessed huge milestones as the National Agency for Food and Drugs Administration and Control, NAFDAC, in partnership with the government of the Republic of Benin, intercepted and destroyed imported tramadol worth over 95 billion naira.
On the intention of some unscrupulous importers to ship 31 containers of unregistered pharmaceutical products, including tramadol, 200 milligram, and we are doing everything we can or we could to make sure that we mitigate substandard falsified medicines. All over the world, we have substandard falsified medicines. What we are trying to do is to bring it to the minimal level, so that if 10 people take medicine, 9.5 will take good medicine.
On the proliferation of unregistered drugs, NAFDAC also arrested a herbal medicine practitioner, Alhaji Salisu Sani, also known as Baban Aisha, for manufacturing medicines with an expired registration license.
Most of the drugs sold by literate and semi-literate drug workers are counterfeit, substandard, or expired medicines. I wish to warn that any drug hawker arrested by NAFDAC will be prosecuted, will face a jail term, and our enforcement officers are currently carrying out synchronized nationwide operation. We want to put an end to drug hawking.
Sampling opinions of Nigerians on how they will access the health sector, some Abuja residents lamented the poor administrative performance so far.
I can give them 50% because most aspect of the provision that are provided is not sufficient to go round. And because it's not sufficient, some people are dying. And so they need to provide funds sufficient and capable to ensure that the thing goes round.
Health sector is a very sensitive area. For a doctor to be able to cure a patient, the doctor must be well. We were not prepared for Ebola, COVID-19. We were not prepared at all. That was the cause. Because those primary health care, maternities, hospitals, general hospitals, were dead long ago. That's why it's a shocker to us.
2024 will be 6 years away from 2030, where the universal health coverage, the SDG agendas and others is to be realized. Regrettably, Nigeria is not on track to meet these targets, but 2024 presents another opportunity for Nigeria to ensure that the health system is given the right attention needed to improve the sector.